Welcome to the Respectability webinar, Implementing WIOA and a Better Bottom Line, Employing People with Disabilities, Lessons from the Front Line. Your speaker for today's program is Rita Landgraf, Secretary of the Delaware Department of Health and Social Services. Our moderator for today's program is Jennifer Laszlo Mizrahi, President of Respectability. Audiocast quality is subject to equipment, available bandwidth, and internet traffic. If you experience unsatisfactory audio quality, please use the telephone dial-in option provided in your confirmation and reminder emails. If you have dialed in, operator assistance is available by pressing #. You can send questions at any time by using the chat window located to the left of the presentation screen. A question and answer session will follow the presentation. I will now turn the call over to Jennifer. Please begin.
Hello and welcome. This is Jennifer Laszlo Mizrahi, President of Respectability, a nonprofit organization working to enable Americans with disabilities to achieve the American dream. I do see that there is an echo on the line, and our technical people are working on that right now, so I apologize for that. But meanwhile, on slide 2, I want to show you some brand new resources that we have that we hope will help you with your work. For each of the 50 states, we have gone through and identified very carefully some key statistics that have to do with employment outcomes for people with disabilities in your state. It also gives you key demographics that can help employers know who is the talent pool that is available for work or might be coming online soon. These are available in accessible formats, both in PDF and in PowerPoint. We have intentionally left our logo off of all of these slides so that you can take them and use them in your own presentations free of any need to credit us. Just use the information, and we hope that it's helpful. I want to also thank NACDD, Best Buddies, NCIL, Paralyzed Veterans of America, and NOD for their partnership with us in a new online employment first planning tool for states that are working on their unified plans under WIOA. It really lists and outlines best practices as you go forward. There is a link to that document also on page 2. We do look for, feedback on that, so feel free to send that. I do see that some people are still hearing an echo, and so we're trying to work on that technology-wise. I hope that we won't continue to have that. I apologize that we have one. I want to introduce our speaker, who is terrific, and I feel really honored to have her. Rita Landgraf is the Secretary of the Delaware Department of Health and Human Services, which in itself is a very impressive job in that she leads $1 billion a year in spending and is really involved in some extraordinary work inside Delaware itself. But also Governor Jack Markell, who she serves in his cabinet, is the leader nationally on this Better Bottom Line, employing people with disabilities. So they're ahead of the other states in working on these initiatives, and so the experience that they have will really help you in your own work. She's extremely talented. We're lucky to have her time. Secretary Landgraf, I turn it over to you.
Thank you, Jennifer, and thank you all for joining us relative to this important effort to enhance employment for people with disabilities across our nation. I want to talk a little bit about our governor and Governor Markell and why he thought that this was a significant area of focus and how he utilized his bully pulpit while he was chair of the National Governors Association to really promote this effort. Governor Markell recognized that as a country, we have not advanced far enough in the area of gainful employment for persons with disabilities. As the slide before you demonstrates, 36% of individuals with disabilities are either gainfully employed or in the process of getting employment. However, when you compare that to the population without disabilities of individuals aged 18 to 64 throughout our nation, 75% of that population is actually employed or seeking employment. This indeed is not equality, and individuals with disabilities do represent a diverse segment of our society who we all know have tremendous abilities and gifts to share. As Greg Wasson, CEO of Walgreens, told the governors at the 2013 winter meeting of the National Governors Association, what he stated was, "We started out to change our workplace, but along the way, we discovered that we were the ones who were changed. As a result, we have better teamwork, team members with and without disabilities who work together at Walgreens turn in the highest performance in the company's supply chain." Now, Governor Markell's initiative outlined in his 2012-2013 National Governors Association blueprint had 3 simple sentences. First, advancing employment opportunities for individuals with disabilities is the right thing to do as a society, and it's a smart thing to do for government, and it makes great business sense. These words are true today as the day he first said them, and something that is a core principle for him. And what I learned in supporting the governor while he was chair of the National Governors Association is that all the governors actually have embraced this as a core principle for them as well. Now, why is this important? Governor Markell believes in expanding employment opportunities because people with disabilities have indeed demonstrated ability and talents, and they are an untapped resource for the employment workforce. When individuals with disabilities are employed and living more independently, they become less reliant on government benefits, and they contribute more to the economy. And when individuals with disabilities are seen as a valuable asset for business, we see it and we hear about it all the time, just like I played back for you what Greg Wasson has indicated as CEO of Walgreens. Business models across the United States, from large corporations, as in Walgreens, to small businesses, have proven results. On the left side of this slide is the link to the PDF of Governor Markell's blueprint that he has shared with his fellow governors. Please utilize that as a resource within your states. Now, here were the recommendations that were promoted within the blueprint. Number 1, make disability employment part of your overall state workforce development strategy. Number 2, find and support businesses in their efforts to employ individuals with disabilities. Our business community is as much a customer as are supporting people with disabilities. Number 3, be a model employer for increasing the number of people with disabilities working in state government. The one thing we talked about stateside is we embrace this as a core principle and outreach to businesses to initiate hiring of people with disabilities. We ourselves, as an employer within state government, need to do the same and model that behavior for others. Number 4, prepare youth with disabilities for careers that will use their full potential, providing employers with that pipeline of skilled workers that we continuously hear about within our business community, the need to match a skilled workforce with their business. And number 5, to make the best use of limited resources to advance employment opportunities for people with disabilities. Now, I want to give you a little bit of a perspective on Delaware and the landscape, something that I know you are well aware of within your own states, but to set the stage as to what Delaware's landscape looks like and how we continue to advance and evolve with the focus on employing people with disabilities throughout our state, both in our public sector and in our private sector. 75.1% of individuals within Delaware without disability aged 18 to 64 are employed. 36.4% of individuals with disability, the same age range, are employed. We look fairly consistent with the national average. 3,800 persons aged 16 to 20 years old have a disability in Delaware. 114,700 civilians with the disability live in Delaware, and 56,402 persons aged 21 to 64 have a disability. Indeed, a pipeline here. Now, employment gap between people with disabilities and people without disabilities actually decreased close to 2% between 2010 and 2011. Governor Markell took office in 2009. 30,631 individuals between the ages of 18 to 64 received SSDI or SSI benefits in the year 2012, and Delaware's total expenditure on SSDI benefits was about $423 million. Our vocational rehabilitation obtained over 1,000 jobs for individuals with disabilities in 2012, and Voc Rehab received 3,374 general rehab applicants and 80 applicants with visual impairments in Delaware in 2012. This gives you an idea of the Delaware landscape. Now let's look at, from a chart perspective, what that represents. This just kind of gives you the prevalence of disability among those individuals aged 16 to 20, commonly referred to as those in transition in our young adult population, that were non-institutionalized. And it gives you a breakdown of what would be a disability category. Here are the individuals across the spectrum relative to those being served by the Individuals with Disabilities Education Act, which also has a focus on supporting students in transition age for gainful employment. So this is just for you to get an idea of how, at least in Delaware, the disability categories are established. Now, here's the prevalence of disability for individuals from the ages of 21 to 64 and how those categories break down within Delaware. And again, our non-institutionalized working age individuals within that age framework by disability status in Delaware in the year 2012. Now, with that in mind, we believe as our governor, as the leader within our state, as our CEO, and indeed a change agent in this area, that we needed to look at our public policies and how our public policies would be in alignment with what our values are relative to employment and individuals with disabilities. So Governor Markell has indeed strengthened not only his state hiring and inclusion, but also in working with our General Assembly, our legislative branch, looking at the policies that govern what our values state. So in July 2012, he signed the Delaware Employment First Act, requiring state agencies to consider as their first option competitive employment for individuals with disabilities. I know many states do indeed have legislation relative to employment first, and indeed using your public policy to set the stage and really promote the value that you have. Now, Delaware's vision is very much in line with focus on employment, and much can be learned from that approach, where Governor Markell was very inclusive across the cabinet relative to this value that he wanted to promote, from him being the leader and the CEO all the way down through his administration. And in doing so, he has asked me, as Secretary of the Department of Health and Social Services, to work hand in glove with the Department of Labor and focus on win-win solutions, not only for us as employers, but also for the business community. We started with a major summit, and it wasn't just for Delaware-based companies or government. We actually also brought together people from across the country who were interested in this topic. This was all occurring while the governor was indeed chair of the National Governors Association. You see the picture on the left at the top is Governor Markell with Senator Tom Harkin. And indeed, the senator and the governor became quite close during the time, and still are, but during the time that the governor really did want to advance, as part of his NGA agenda, employment of persons with disabilities. As many of you know, that Senator Harkin is a true champion of not only the Americans with Disabilities Act, but actually with the focus of going further. We have not come far enough and the area of employment for individuals with disabilities. So both Governor Markell and Senator Harkin were indeed hosting a major summit relative to attracting businesses across our nation, advocates of major disability organizations, including foundations, the philanthropic community, as well as other leaders, to brainstorm and focus on solutions to really advance and move this needle relative to employment of persons with disabilities. All the people at the summit really did embrace that real change will take place from a strong public-private partnership driven by meeting the needs of employers and by aligning successful and reliant talent to those needs of the business community. Delaware's vision then is to promote an open atmosphere in which our employees feel comfortable in disclosing their disability, that we need to provide education and support on meaningful accommodations, and that we need to provide individuals with disabilities with the same opportunities and environment to succeed as anyone else. Now, what is Delaware's workforce strategy? That individuals with disabilities often do not get the same opportunities, and that this increases the financial security gap between individuals with disabilities and individuals without disabilities. This has been very concerning to not only the governor, but to all of us here as we work towards empowering people with disabilities. Individuals with disabilities have a tendency to remain in poverty. Why is that important to me when I wear my hat as Secretary of Health? I know that the number one determinant of poor health is indeed poverty. So why would I want to promote that a cohort of our population is relegated to poverty in order to access support services, many of which sometimes fall within our Medicaid program? So indeed, this is also a conversation relative to the poverty issue impacting individuals with disabilities. So Delaware is looking at this from an innovative perspective to increase the options as a main component of our overall workforce strategy. And in order to achieve this state's employment program, Delaware will serve individuals with disabilities with a focus on those transition and young adult years starting at age 14 to age 25 who have a desire to work in a competitive work environment. We will provide individually tailored services to assist individuals to explore and plan their careers. That we will include services to support individuals to maintain employment based on their special needs, whether that's job supports, whether that's in transportation, personal care, orientation and mobility training, and of course assistive technology, and that we will do that through leveraging of our Medicaid program. That is called, in that program, Pathways to Employment. We are also looking very focused on individuals who have serious persistent mental illness, as well as individuals who are living with addiction. And we are creating a similar program that I just talked about, Pathways to Employment, which is called our Promise program, with comprehensive community-based services that have been designed to support individuals specifically with these conditions. This will start actually at age 18 with the adult population, and actually we just got approval for both our Pathways to Employment and our Promise program from CMS to bring this to the implementation stage, again, with a strong focus on workforce and employment. Now, Delaware has also reaped many benefits from working in concert with the U.S. Department of Labor's Office of Disability Employment Policy, ODEP. We have indeed received technical assistance from individuals across our nation that are doing best practice initiatives to increase employment for individuals with disabilities. Delaware was one of 6 states invited to participate in the Employment Resources Rebalancing Initiative, and an evaluation was conducted relative to our current systems, our policies, and our practices in order to determine if indeed they are in alignment with our public policy and our employment first priority. We still have much to accomplish to fulfill this transformation, but many times it starts with looking at where are we today and then how do we effectively build that level of transformation. We recently were awarded another technical assistance grant from ODEP that will focus on our capacity building in effective practices. And this will focus on our training protocols, our workforce skill sets, and this does support Governor Markell's emphasis on employment first and in finding win-win solutions for both the employer and our potential employees with disabilities. And how do we advance that? We need our workforce as well that supports individuals with disabilities to be side by side with us to ensure success. Now, we are embarking upon an employment first communications plan. You know, many people read the policy but don't necessarily understand how this will be implemented. So we are working on our communications plan, and we are directing that towards our consumers, our students with disabilities, so it goes hand in hand with the Pathways to Employment, with that focused on starting at age 14, with the parents and families of individuals with disabilities. We heard a lot during Governor Markell's National Governors Association that many times it's all about the expectation, and many parents aren't provided the necessary communication relative to the expectation that even individuals with the most significant disabilities can go to work. And we also need to communicate with the workforce itself, inclusive of those who work in early intervention programs and schools and the adult service delivery system. So we are embarking upon that now in putting those materials together, and then how to advance a wide-based communications plan and process. I did want to talk about also Governor Markell's laser focus on employment of persons with disabilities. Governor Markell read about a program out of Denmark, actually in the New York Times several years back. And I remember the call that I got to the governor one day in August back in those years. And he said, Rita, I'm reading this program I'm reading about this Denmark program called Specialisterna, where it matches individuals who are on the autism spectrum and have Asperger's with IT companies because they found that that has a special niche and they're able to be successful in that support. He read that Specialist Turner wants to have a presence in the United States, and he said, can we get them here in Delaware? So actually, with the governor, we reached out, and we were able to set up some time with Turkel Solm, who is the founder of Specialist Turner, a parent who has a child with Asperger's. And what we were able to do was bring together business leaders. And in bringing together business leaders from Delaware, we found a business, CAI, that also supports individuals and companies and the state of Delaware relative to information technology. And it actually was something magical to watch because the CEO of CAI and the CEO of Specialist Turn have now joined forces, and CAI has brought in Specialist Turner to help with the education and the training of the individuals, but also then to bring those individuals into the CAI workforce. And many of those individuals are now serving us within my Department of Health and Social Services, and are now also, because we have a great need for information technology support, they are also now serving across the state government as well as serving CAI with their other corporate partners in the private sector. And all of that was to support the governor's vision and the leader in this arena. So CAI, through this initiative, has committed to hiring more than 3% of its workforce by the end of this calendar year, and with individuals with autism, recognizing that individuals are especially qualified for these technology roles. And they're engaged in software testing, data quality assurance, programming, data mining, and data entry, which many times is a great need for me as a public official. So it was a win-win, not only for Specialist Turner and CAI, not only for that partnership that the state government has with both these organizations, but now we are able also to hold this up as a business model that other businesses are falling into suit with as well. So the governor continues to advance that model, again, within his own administration, as well as with the private sector and beyond the borders of Delaware. Now, Governor Markell's initiative did indeed create a major spark in our own Department of Labor, with an increase of close to 9% of individuals with disabilities becoming actively employed from 2011 to 2013. Delaware has seen an increase in the number of employers now engaged and in the number of individuals with disabilities actively seeking jobs. It definitely has gotten the attention, and now we're focused on the delivery. Now, we are working closely with our Healthcare Association. We also know that healthcare is getting a lot of attention these days, maybe one of the fastest growing sectors, and we do see a lot of activity with much reform occurring across our country as well as within each state. So we are partnering with our Healthcare Association, which is made up of Delaware's hospitals. They indeed actually asked to join in with us and have signed on to the governor's initiative, and they are in the process, many of which are already part of Project Search, but they are also looking at how can they enhance their internships, how can they expand their internships, and how can they build their own recruitment from these efforts to highlight hiring people with disabilities as part of their workforce development strategy. We also, relative to our own state hiring practices and support of people with disabilities, we wanted to understand from the ground itself relative to our practices as a state employer. So we worked with the University of Delaware to create a survey and actually to administer the survey with our state employees. And what the university did in collaboration with the state government is they surveyed 17,000 of our state employees. Please remember, Delaware is a rather small state. So we have 17,000 state employees. And our return on that survey, which was anonymous and was actually conducted through the University of Delaware, not the state government, we had 5,000 respondents. And with the questions that were asked, we wanted to determine the needs of the state as the employer with respect to evaluating the attitudes and the hiring practices towards state employees with disabilities. What we learned, two key areas. Our human resources training initiatives needed to be updated related to disability awareness, and that we needed to refine state hiring practices and systems for recruiting qualified applicants with disabilities. So as we focused on our human resources training initiatives, we created an online class available to all state employees, which is required now for all the state's hiring managers as a prerequisite for additional classroom training. So it's not just a one-time training, it is a continuous training, but the first online class is required for those hiring managers. Many times a hiring manager can determine how a person with disability will be treated throughout that process. The state of Delaware has piloted the online training with the classroom training that began in October 2014, and we are very excited about the feedback that we are receiving on that. The State Office of Management and Budget, in collaboration with the Division of Vocational Rehabilitation and the Division for the Visually Impaired, has ensured that our selective placement program is one hiring option for individuals with disabilities who seek employment in state government. And this is indeed a preference program. In Delaware, I'm sure, like many other states, we have a merit system where people compete and have to have certain competencies relative to accessing state employment. What we do under selective placement is we actually look at the skill sets of individuals with disabilities, and if indeed they could be a preference in order to get that position, as opposed to going through the merit system process. We have had success, and that has worked for both the individual as well as for the department, the division, or the office that they will be working within. Governor Markell's initiative has indeed brought heightened awareness to this process, because indeed prior to that, we did not see a whole lot of activity relative to the selective placement. In addition, our nonprofit organizations that work closely with both our DVR agency and our Division of Visually Impaired agency have received training on selective placement in order to better assist in qualifying eligible applicants. So in turn, to make sure that we have that pipeline, we wanted to work with those not-for-profit organizations who can qualify those eligible applicants for these positions. And resources include a publicly available training video that is on our Office of Management and Budget website. It's entitled Untapped Talent, Ready to Work. Please, you can access that, and it will provide you with information about including people with disabilities in the workforce, the accomplishments that can be gained from utilizing this untapped resource. Our Office of Management and Budget also has developed a web page titled Selective Placement for Job Seekers, which is for those individuals with disabilities who may be interested in selective placement within state government, and will provide information relative to that. So indeed, we enhance both sides relative to the not-for-profit organizations that qualify those eligible applicants, and individuals, those job seekers, who may see this as an option for them in looking for employment. Now, in July 2013, we convened a work group to develop and issue, again, the survey to all state of Delaware employees, and to assist in enhancing employment. And this survey asked participants with and without disabilities to share their experiences and ideas about employment of individuals with disabilities by the state workforce. We did have, as I noted earlier, a pretty high participation rate, about 31%, and so we were very pleased by the level of engagement. The governor encouraged people to fill out this survey, as well as myself, on an ongoing basis, and indeed, we did get some very meaningful feedback that has been guiding us as we look internally at enhancing our own practices here within state government as an employer. So using the ADA definition, here's what we learned. We learned 11.8% of state workers self-identified as being a worker with a disability, a statistic that really is in concert with the prevalence of disability in Delaware. But what I must tell you about that, remember, this is an anonymous survey. If you look at those who did self-identify outside of the survey, but in their official context, relative to gaining employment within the state of Delaware, it came up at less than 1%. So we immediately became aware of the fact that there is a disconnect between a person self-identifying that we are aware of who works in state government versus those that anonymously were self-identifying. So we wanted to better understand why that is occurring. That is very good information for us. In our survey, we identified 44% who self-identified as having a disability did indeed request at least one reasonable accommodation, and we learned that 1 out of 3 respondents had encountered a comment, most often made by one of their coworkers and or their supervisors, that indeed made them feel uncomfortable. All meaningful information for us as we look at advancing. We learned that 1 out of 5 believed that they had been physically or psychologically intimidated or threatened due to their disability, most commonly by their supervisors, but then followed by their coworkers. Of these employees, 1 in 3 took action to address this matter and typically would report the situation to a supervisor or the HR department. And less than 1/3 of all our respondents, despite disability status, were aware of specific resources within state employment to support employees with disabilities. So indeed, we had much work to do here, but it gave us a benchmark that was critically important as we look at advancing our own employment practices. Now, our online class, as a result of this survey, both an online class and training specifically set up for managers and supervisors was indeed developed, and we actually went live with that in October of 2014. We made that in concert with the National Disability Employment Awareness Month, so we could leverage what was happening nationally as well. And it's called Focus on Ability. And again, we have the link here if you would like to explore that as a resource as well. And you will see on this slide that, of course, we have a message from our governor to champion this training. And what is our focus on ability? What does that include? Some of the highlights are listed here. The benefits, of course, an overview of the Americans with Disabilities Act, describing invisible disabilities, including those disabilities of mental illness, and focusing on dispelling myths, and interaction comfortably with employees who have a disability, including examples of respectful behavior and communication tips, and then indeed identifying the resources available to our employees. And our classroom training also coincides with the online class. So a much heightened focus and awareness. And in addition, we've developed an online resource section with our employment recruitment website, just in general the recruitment website, to offer specific supports to our workers and employers of persons with disabilities. And we will continue to evolve around Delaware's new website and build ongoing enhancements relative to employing people with disabilities. So these are just employers, I've mentioned CAI, who continue to embrace talent and diversity and who work side by side with us to get this message out. Walgreens here in Delaware, following the national lead, GlaxoSmithKline. Many of these employers are also part of the U.S. Business Leadership Network, and so we've gained a lot of traction in working with the U.S. Leadership Network as well. I mentioned the healthcare sector. Again, in Delaware, we do see the youth as a strategy and a specific focus, and in working with our Department of Education to bring forth the promise of the Individuals with Disabilities Education Act. We all take advantage of education. Governments invest in billions of dollars to educate our youth. We really want, through that education, to be successful, to lead to meaningful opportunity and career. And you see some of the highlights here I mentioned earlier with the health sector. And the project search model has really indeed taken off relative to our healthcare system, but that model can be replicated across. And we are working now also with Disability Mentoring Day, which occurs in October, to reinforce throughout our state in various venues, inclusive of the private business sector, but also working with our high schools and working with our universities and colleges to promote that as well. Now, on March 26th of 2014, Governor Markell signed what we call as our Executive Order 44, which is allowing businesses owned by individuals with disabilities and certain small businesses to be included in our state's supplier diversity efforts. And it expanded the scope of our Governor's Supplier Diversity Council to also include the study and consideration of how the state of Delaware does business with enterprises owned by individuals with disabilities, as well as certain small businesses. And I have a web link here as well that talks more about that executive order. But this indeed is how the governor uses his leverage to enhance employment for people with disabilities. I mentioned the initiatives that we continue to do with ODEP, and that has really also helped us taking philosophy into the implementation. Indeed, I believe everybody in Delaware does have a philosophical support of employment of persons with disabilities. Now we have to ensure the tools are there to really promote it from an implementation perspective. And this just tells you more relative to the work that this state has been doing with ODEP. And we want to be able to capitalize and leverage those federal programs that are so meaningful to people with disabilities and to states. So I mentioned about the leveraging of our Medicaid program. We continue to look at Medicaid as a vehicle to expand our community and employment-related benefit options for all those Delawareans who are eligible. And indeed, going across disability groups, our pathways to employment is not categorically defined by disability, but more about robust services that can be leveraged to support individuals with disabilities. And again, with the focus on the ages, the transition years, age 14 to the young adult age of 25. And the new that's our pathways to employment. And also it shares with you some of the services that are part of pathways, inclusive of also financial coaching and empowerment. What I have found in the state, many times the population, inclusive of people with disabilities, there's a financial literacy need as well as a health literacy need. How do we support people in meeting their financial goals? Many times we do not have those conversations even in general, but for people with disabilities, many times that is rare to talk about your financial goals, especially if individuals are dependent upon public assistance. So we wanted to also talk about that level of financial coaching and support to build that financial security that we all want for all of us. Delaware is indeed on track for the Medicaid waiver program for these services, and indeed we were very pleased by approval of CMS recently within probably a 2-week period, both in our Pathways and our Promise program. These are just people that have actively supported Delaware's Project Search. You are welcome to visit these sites and talk to these individuals if you're interested in how they promote the Project Search within their organizations. Delaware's expected fastest growing occupations. We work closely with the Department of Labor to look at the fastest growing occupations and the interest of our sector of individuals with disabilities and how we can link that so that we have that pipeline that will not only support individuals with disabilities, but will also support our business community. And we are always happy to give more information and to learn from you out in the field as well. And this is my contact information, and I am joined today by my communications director, Jill Friedel, who is also very, very accessible. And as I mentioned to you, relative to the communications plan, in order for us to facilitate this, we need to message it across the entire sector, inclusive of the consumers, inclusive of their family members, inclusive of the workforce, and really be informed on not only delivering that message, but listening back to what may be the dreams, what may be the fears, and how do we bridge those gaps to create an effective process of enhancing employment for persons with disabilities.
Secretary Landgraf, that was quite extraordinary, and we're about to take questions. But before we take questions, and first of all, thank you again for an extraordinary presentation, I do want to remind people that the first slide we saw up front gave you the statistics for your own state. So Secretary Landgraf did show you several statistics that are for her state of Delaware, but your state, each state has a set of statistics up front. The links are right there in the PowerPoint. The next webinar coming up for us is going to be the webinar that is with a speaker who is talking about best practices for hospitality industry. So it's a youth transition program that is really quite extraordinary that is happening in Nebraska, and it's David Scott who's running it, but also we have a professor who is an expert in hospitality management as a career track for people with disabilities, and she is also quite extraordinary on best practices. It's not yet listed on our website, but after that, we have the experts from Montgomery County, Maryland. Montgomery County, Maryland has amongst the highest employment of people with disabilities in the world. It has elected by vote, they had a ballot initiative which passed with 80% of the vote for affirmative action for employment of people with disabilities, and also because it has a very large number of different people there who are federal contractors, and with the new rules around federal contractors with Rule 503, they must have integrated employment with 7% employees in all job categories. So that will be really quite interesting. I want to turn it back to Q&A, and so I want to be looking to our moderator to explain to us how we can do the Q&A, but there's also some resources for additional data if you're looking for additional data, and you can always just email me if you need more data. So let me turn it over to questions. Operator, if you can explain the questioning process.
Ladies and gentlemen, if you have dialed in and would like to ask a verbal question, press 7#. That's 7 followed by the pound sign on your phone now, and you'll be placed in the queue in the order received. Just listen for your name to be announced and ask your question when prompted. You can also send questions using the chat window located to the left of the presentation screen. Simply type your message in the rectangular input field and press Enter to send it.
The first question, Secretary Landgraf, is really about this wonderful relationship that you have with the Department of Labor. There are other states that don't yet have that sort of favored state status of being one of 6 states favored for a program. So how did you build a relationship with ODEP, and what do you suggest to other states interested in strengthening that connection?
Thank you. And actually, I think where the relationship really did kind of take shape was through the work of the governor and the National Governors Association. And again, I think we were very fortunate that Governor Markell selected this as chair as his topic to focus on for a year during his chairmanship, and we're really embracing a variety of sectors, including the federal government and of course the U.S. Department of Labor, and working closely with ODEP within that process. But in saying that, because I think that was a very special opportunity for both Governor Markell and myself and for the state of Delaware. But I also encourage to build relationships with people within the Office of Disability Employment Policy. I mean, I have found that they do want to extend their reach to the states. They might not be able to provide a level of resource to every state, but I do believe that if you reach out to them and indicate that you want that level of engagement and start a conversation, they will help mentor to get you to actually to the point that you want to be relative to being considered for technical assistance.
Great. Janet S. asked, the Pathway to Promise using Medicare dollars to provide support. What percentage of people with disabilities in Delaware qualify for such Medicare services, and how long is the waiting list for such services?
Well, and I think we have to remember Pathways is a new state plan amendment for us, so we haven't actually implemented yet. We just got approval from CMS. We were hoping to go live January the 1st. We now think that we'll probably go live closer to March or April based on the back and forth between, the state and CMS as we were developing that as a state plan amendment. And we do not anticipate a waiting list. Delaware, to some degree, we are fortunate based on the fact that we have an established waiting list. And we also believe that in concert with, for instance, our Department of Education and working closely with our schools and working closely actually with our Division of Vocational Rehabilitation, that we will be able to support the people that are coming through the Pathways program. And we hope to be sitting at that table, especially for those students that are, being supported at the school sites with individualized educational programs, that they see this as a venue to better support them in gaining employment. I will say that, that many times as we work with the school systems over the decades, I've seen that sometimes the Department of Education and those schools have been stretched relative to affording people with disabilities the opportunities to get outside of their buildings. Sometimes transportation comes in as a barrier to really explore in the outside of a school building what vocations are possible and what do these students actually would like to explore by having access to those vocations, either through job shadowing or just through internships or experiences. So we want to be able to, again, leverage the resources that opens that back up in a more meaningful way for that student. We do know that for every job experience a young adult gets with disability, it enhances their employability, and it enhances that this will indeed become a job for them when they exit the school system. And that is why we are really focused on, first, the population from 14 to 25.
Excellent. We're getting a lot of calls about the links in the materials. So let me just say that all of the links in these PowerPoints should be live links, but also you should be able to download currently the PowerPoint so that you can keep it if you go back to the invitation to join, there was a way that you can download the PowerPoint and you can keep it. There's a question, Secretary Landgraf, about the training and what it can do for the people of California, all fine and good what you're doing for Delaware. But the materials that you've developed, for example, the HR materials, could another state have access to that? Are they copywritten, or are these things that are available for sharing?
Oh, they're all available for sharing. That's why we wanted to put those links up there that you can just come on to our website. And please get in touch with me if there's more information that you need. I do have a work group that is actually focused on enhancing employment of persons with disabilities within state government and working with our Office of Management and Budget, who supports that whole human resources role for the state of Delaware. And I know Andrea Guest, who is the director for our Division of Vocational Rehabilitation, and we co-chair that together to form that linkage. And also, I believe Andrea is on the call, as well as Dan Madrid, who's the Delaware Division for the Visually Impaired. So, we really have found that we benefit together in approaching these issues, because we each bring our own level of perspective and expertise to the table. And we've been very fortunate here in Delaware that across our government that we're able to do that. And I think that starts with our governor setting that tone for us.
Great. And if people have more questions beyond that, they can always email me if you want more links or more resources here at Respectability. Robert L. has a question. Has Delaware's selected placement program worked successfully with people with intellectual and developmental disabilities?
Yes, it has. It certainly has. And indeed, that selective placement program is available for anybody regardless of disability. But actually, I must tell you, I use that program to hire a communication assistant within my office of the secretary, and she is a young adult with a developmental disability who actually went through Project Search. And so as an employer myself, I can attest to the value of not only selective placement, but also the value of Project Search. When Alyssa was placed here in my office, she was ready to hit the ground running. She knows more about how to post on Facebook, how to help me with my cell phone than I could ever learn. So indeed, the opportunity that she received through Project Search has really benefited me as her supervisor here in my office. And she has enhanced the culture here, not only in my office, but I can tell you that when I go out on campus, I'm responsible for about 4,300 employees. They indeed know Alyssa, so she actually makes me look good.
Fabulous. We have two questions from Robert D., who asks, with a fairly typical employment stats you cited on workers with disabilities, do you have a picture of their overall well-being, number one? And his second question is, what do you think the ABLE Act will have in terms of an impact on these issues?
I'm glad that you brought up the ABLE Act, because indeed we do see this as a victory for people with disabilities. I have heard some complaints that it doesn't go far enough, but indeed, I think everybody can relate to in the political arena and in government. It's good to get that nose of the camel under the tent, and then many times you can push in that whole camel to fall under the tent. So, I personally, and I know my colleagues here in Delaware, see this as a great victory, if you will, for people with disabilities, and something that can be expanded. Again, as we talked about financial empowerment and financial security, this is setting that conversation in a more formalized manner. And again, I'm going to relate health outcomes. Poverty, again, is a social detriment to someone's health. And in Delaware right now, we are working closely with our Center for Disability Studies at the University of Delaware, to talk about with a focus on healthy outcomes for individuals with disabilities, because indeed there's a disparity relative to health. So, as Secretary of Health, it really does give me that bully pulpit to really expand upon that, not only from the employment piece, but also what does that mean relative to advancing healthier outcomes for persons with disabilities.
Thanks. And let me also add that on each of the PowerPoints that we did for the 50 states, there are some key stats about health, smoking, obesity, poverty, et cetera, for your state that compares people with disabilities to people without disabilities within each of the 50 states, so that you'll have that for no matter what state you're calling in from. Secretary, I'm very interested in your perspective in the changing culture that WIOA offers in terms of previously people really thought of employment for people with disabilities as strictly the purview of voc rehab. But under the new legislation, it falls more broadly under workforce development and the workforce boards and the workforce agencies. What is it like to have this shift in culture where now you have a governor himself looking at it holistically through the states? Are there some bumps that you're encountering, and how do you sort of deal with those culture change issues?
Well, and I think everybody can appreciate, Jennifer, the culture change, and again, shift in culture does evolve over time, and it's how do we bring everyone to the table who can play a critical role, but I think everybody would agree that we do want to enhance employment for persons with disabilities. What tools can we utilize to do that? And we do need to align that entire workforce development and not silo that. People with disabilities are a cohort of the entire workforce development strategy. And so how do we leverage that in the most effective way that we don't end up siloing cohorts that then have more of a difficulty in integrating into that workforce arena? And our Workforce Investment Board has always been inclusive of individuals with disabilities. So I think here in Delaware, there was already a commitment to supporting people with disabilities from within that framework. But indeed, when you think about advancing, we need as many tools as we can possibly get and gain. And in each state, that might look different. My concentration relative to my role as Secretary of Health and having the benefit of being the administrator for the Medicaid program was to really look at, in my limited time of service as I serve under Governor Markell, to really look at how do I leverage that. I believe the Department of Labor works very closely with us as a department, not only with voc rehab, but entirely as a Department of Labor and the Department of Health. So how do we join forces to better, advance this focus? And it's been quite positive. But again, I think now what we are concentrating on, again, is first you adopt the strategy, and then you talk about how do you bring that strategy to the ground. And that's where we are right now with WIOA. And, I will be sitting on the state committee looking at that. So it's very, very inclusive. I believe a lot of that is, because our governor does indeed set that tone, and that's an expectation. But it's something that we're all excited about supporting.
Now that we have so much data that's been available through Mathematica and other groups that have taken a look at what works and what doesn't work in terms of employment for people with disabilities. And we see that you're investing a lot of energy into what works, which a lot of it is transition from school and youth into the workplace, starting with this really focus. I mean, you're doing things you talked about today, early childhood development, working with parents when children are young, talking to parents when when the kids are 14, and these transition programs you have like, Project Search and others. What are the things that you have discontinued doing because you found they were not worth the investment in the same way, or that you're not expanding because you're finding that you get better value for your public dollars in other ways?
Well, and I think where we are concentrating is again on the focus of integrated competitive employment. And really, we haven't some states have discontinued some services. We are looking at how we can transform. And again, working with, as you indicated, even at that early intervention stage so that we can produce an expectation that as we invest in our children, regardless if they have disabilities or they do not have disabilities, that investment is to support our children as they go through their education system, starting in those early years. How do we use our investments in a way that child will continue to advance and to grow, and what supports do we put into play in order to ensure that, so that child gets a return on our investment, and so that we as a society get a return on that investment. So Jennifer, we're kind of, really concentrating on how do we build from that framework, and then we believe that those programs that may not have that level of return on investment, or that may not have had those expectations, will eventually become obsolete. And there has been controversy across the country relative to advancing or dismantling, some programs that haven't had that level of return on investment. Right now in Delaware, we're concentrating on, how do we continue to focus on advancing not only the investment in individuals, children with disabilities, but that through that investment, we are going to get not only a greater return fiscally for that investment, but primarily that individual is going to elevate out of poverty and live in doing something that is meaningful, integrated. I always say that society benefits from its diversity, and how we approach things is largely enhanced because we each bring different perspectives to the table. My own Office of the Secretary has advanced because I have a lens of an individual with an intellectual disability. So that is a model that really does work. Greg Wasson says the same thing relative to Walgreens and what he saw when he advanced a focus on hiring people with disabilities. So we need to ensure that it's not only the hiring, it starts from the time that early childhood, and how do we continue to advance.
Great. We're getting some questions about leveraging some of your investments with non-governmental investments. So, for example, how important are the parents of people with disabilities or their family members or other nonprofit organizations or others out in the community who are non-governmental who you might be able to bring to bear to the question?
Extremely important. That it is extremely important, and that is why, as part of our ODEP technical assistance, that we are focused on that communication plan that I talked about, that actually goes outside of us, that is more focused on the students with disability, the parents, their families, and of course the workforce, because I don't know if other states are experiencing what we have experienced here. Reform is never easy. And it really is hard work. And many times, you may have competing forces. So how do we take our, not only the philosophy and our focus, but how do we effectively then communicate that with outside of the government, with the non-government organizations that actually support people with disabilities? I'm very pleased with the work that's going on with the Council of Foundations, making this as well as a focus for that council, because that's your philanthropic arm. We know that much of of the work that we do is supported by government funding, but it's also supported by non-government funding through the work that some of our provider agencies are doing. We know we have to involve the schools. We know we have to involve our parents, starting at early intervention. So we can't, my goal is not to focus on this from a hammer perspective, but to really engage in this from not only the conversations, listening to the dreams across the sectors, but also the fears. What are the fears? Are the fears here today? And working with families in my previous career, a lot of what I heard was, a fear of the future, and, this may work for my child now, but what if they lose that job? What happens then? Well, a lot of those things, we can build those strategies around that. So communication outside of the government sector is critically important. I think as we put together our communication plan and as we take that on the road, I will be learning, how that is received as well as how to deliver it. So that's going to be a critical piece of the work that we're doing here in Delaware. So more to come on that, Jennifer. We'll keep you posted.
Great. Joshua asked, does Delaware have Medicaid buy-in? Do you use SSI income and asset limits for non-SSI eligible Medicaid clients, 300%ers, for example?
We do have Medicaid buy-in. We call it Medicaid for Workers with Disabilities, something that I do want to continue to explore because I still think it keeps people from advancing economically, even within our Medicaid buy-in structure. But, one of the, I feel like there were many benefits relative to the Affordable Care Act, but the one benefit relative to pre-existing conditions no longer being counted in order to have access to health insurance, I think also was a big victory for people with disabilities. And I remember meeting with a group of insurers that the American Association of Persons with Disabilities had put together actually during the Governor's NGA initiative, and talking about now the ability for people with disabilities to gain health insurance, especially if they are employed, that before it may have been too costly or prohibitive because they had a pre-existing condition of a disability, especially those that have developmental disabilities. And something that I would like to explore as we think about both Medicaid and actually Medicare, but something I would like to explore, that health policy of Medicaid has not necessarily been fully modernized since the 60s. So our society looks a lot different than it did when Medicaid was first initiated. And now with the ACA and people gaining more employment and having access to health insurance, traditional health insurance, how then again can Medicaid be modernized to support those functions that traditional health insurance would not support? But rather than using the Medicaid program in a way that people with disabilities rightly depend upon, but rather than using that from a perspective that they're fearful of losing that Medicaid and therefore make life decisions based on that, how do we leverage Medicaid in a more flexible way? And I think that we still have to have, this level of conversation with a variety of policymakers, constituencies. But what I was very encouraged by is gaining CMS approval, again, for pathways and for promise, especially pathways where there is a heightened focus primarily on employment, regardless of the disability category, and how do we build a robust menu of service to really focus on the employability of individuals through the support of the Medicaid program.
Great. Ben B. asks, in your efforts to increase employment of persons with disabilities as part of the state workforce development strategy, what approach has been taken to address physical and program aspects for individuals that have disabilities?
And that's an area that I think we probably need more work. And Jennifer, as you know, we are celebrating 25 years of the ADA coming up. And indeed, the ADA is historic legislation. And I started the presentation that we haven't gone far enough relative to the employment. And I still think, even within our own state, we still have a lot more work to do relative to even the physical accommodations. And that's why we were, very thankful for the survey of our own employees with disabilities and some of the things that we saw relative to myths and attitudes and access to accommodations. It really informed us, from not only the lens of people with disabilities themselves, but from the lens of our entire workforce. What we do know, when we think about accommodations, because I also hear this from the business sector, and there seems to sometimes be a myth around, an accommodation and the cost of that accommodation. And, on average, the accommodation cost is like less than $500. So when you have that level of conversation with either a business or even inside our own state government, we really recognize that people walk around with these myths that are not based on fact. And again, I would encourage states, especially if you're looking stateside, relative to how do we enhance our own practices relative to our hiring, the recruitment of people with disabilities, the actual hiring, and then, of course, the retention. The other area that I think that I would like the state to explore further, and, again, we're evolving as a state ourselves, is also when I think about retention. Many times people acquire disability later in life, and what I have found here in our state government, that many times they then do not return to their occupation here within state government, and we need to look at that too. That'll probably be the next phase of our exploration within the state government and our hiring practices. Retention plays a big piece of this, as well as career advancement. Part of our survey that we also saw, there's very few people with disabilities actually advanced in career. Well, I need to understand what are the barriers for people to return when they acquire a disability, and also how people can advance, here in state government who seem to be at a disadvantage for advancement.
Great. Operator, are there any phone call questions that are in the queue?
None at this time.
The last question then comes asking about the UN CRPD and whether that had any influence on your work.
The Bill of Rights, indeed, is something that always has influence. For me, prior to becoming a state agency director or cabinet level, I was in the private sector, primarily in a disability advocacy organization, and really looking at the civil rights for individuals with disabilities. So, at the core, it's not only a civil right issue, it's a core value. And again, it was easy for me to join Governor Markell within his leadership, because he carries that core value too. And I believe, as I look at civil rights movements across the history of our nation, again, I celebrate, again, we're going to be celebrating the ADA, 25 years of the ADA, and I believe we should pause and celebrate how far that this nation has come. But, we also, to some degree, have indeed not gone far enough, and especially when I think of the empowerment and access to employment. I mean, I can tell you, I still see significant barriers, even built barriers that were the tangible kind that could quickly be rectified. We still have places where people with physical disabilities cannot gain access, and it's been 25 years. So, I think from a Bill of Rights perspective, we still have a way to go. And again, that's why we need to stay focused on how do we continue to evolve and advance, what are the barriers that get in the way. Sometimes my concern is that many times we get caught in those arguments relative to philosophy, and many times that's, if we don't say focused on the execution, many times we can stall relative to actually the implementation. Not to say that we don't need to keep those Bill of Rights and those civil rights in front of us.
Secretary Rita Landgraf, you've been extraordinarily helpful today. As always, Governor Jack Markell is really at the forefront of this, along with the state of Delaware. We feel really lucky to have had you with us today. We have our next call and webinar coming up on February 19th on best practices and success in inclusive employment in the hospitality sector. Following that, we'll be looking at Montgomery County as a center of excellence, one of the highest employment rates for people with disabilities in America. But really, I think we've learned an extraordinary amount today from Secretary Landgraf. I want to thank you again for all that you are doing, not just in doing this call, but the 24/7, 365-day-a-year work that you are doing on this issue. Your state really brought it to the forefront. And the work that you did through the National Governors Association, I believe, was really pivotal to the national agenda as it looked at WIOA, and it passed it overwhelmingly and has now been signed into law. And we now have Rule 503 for inclusive employment amongst federal contractors, which, by the way, in each of these state PowerPoints, you also have a link to a list of all the federal contractors listed state by state. So we are here to help, but nothing could be more helpful than to hear from someone who's experienced on the front line. So Secretary Rita Landgraf, thank you again for doing this today.
And thank you, Jennifer.
This concludes today's Respectability webinar. Thank you all for attending.